Let me check. Yeah, it's okay. Let me. Dani doctor, virtual backgrounds
add image plus just add
okay. Add image.
Ma'am kodutille.
Okay. Other.
Yeah. Yes, ma'am. Now it's okay. Yeah. Thank you.
Thank you.
We can play the video.
Is it okay now?
Okay. Yes.
Yeah. Okay. Thank you.
Yes, ma'am. So namaste, good evening everybody. Hope you all are having a great day and doing well. I am Dr. Dhanyasi Radhakrishnan, Senior Medical Officer and co-host for today's session. We are truly delighted and honored to have you all with us. Just a few house rules before we get started. Only the first 1,000 participants will be able to view through the Zoom link, and all the others can watch the live stream through our YouTube channel. For an uninterrupted listening, we have turned off the video cameras and muted all the invitees. If you have any queries during the webinar, please convey it through the Q&A, which you can see at the bottom of the Zoom panel. Thank you for your cooperation. The schedule of the webinar will focus on clinical approach to menstrual compliance in Ayurveda. Now, I would like to request Dr. Anil Kumar, our Executive Director, to have the welcome note. We are excited to meet our eminent speaker and moderator for the session. Over to you, sir.
Thank you very much, Dr. Danya. Good evening to all of you and namaskar to all the participants. I, with a great proud and with the great honor and I welcome all of you, all the participants to this webinar. And this webinar is actually conducted by Kerala Care Foundation, which is Kerala Ayurveda Research and Education Foundation, which is actually promoted by Kerala Ayurveda Limited. We have been conducting this webinar series for the last 6 months, and there has been a lot of encouragement and participants, and there have been more than 1,500 participants in many of the webinars. And we have covered a lot of subjects, and today's subject is menstrual complaints in Ayurveda, clinical approach in menstrual complaints in Ayurveda. And we have two eminent speakers. We have an eminent speaker today, Dr. Asmavi Mangalat. She is from the government department of Kerala, Ayurvedic department of Kerala, ISM department, and she will be speaking on this subject. And the moderator is Dr. Sadat Dinakar. Dr. Sadat Dinakar is the General Secretary of AMA. And AMA is the leading Ayurvedic Association of Ayurveda Doctors. And he's General Secretary of AMA now. And he is also Chief Physician of Kerala Ayurveda Limited, working with us for more than 22 years. And he is also a member of the 14th 5-year plan working group of Government of Kerala. And he was also Chief Editor of APTA of AMA, which is official magazine of AMA. So Dr. Sadat will be moderating this webinar. And this is a continuing education program of Kerala Ayurveda Limited. And Dr. Asmavi Mangalat will be speaking on the subject. So over to Dr. Sadat. Dr. Sadat will be introducing Dr. Asmavi Mangalat. So welcome to all of you once again, and also the speaker, Dr. Asmavi Mangalat and Dr. Sadat. Over to you, Dr. Sadat.
Thank you, sir. Thank you, sir. Good evening to all, and namaskar all the participants. Clinical approach to menstrual complaints in Ayurveda. The topic of today's class is very important and relevant. In India, the prevalence of menstrual disorders has been recorded as high as 90%. Menstrual disorders are common among women in reproductive age group and affect their normal functioning and social life. Due to cultural reasons, menstrual problems often get unreported and it affects the quality of life. For menstrual complaints, especially with adolescent girls, parents rely on Ayurveda as a side effect-free treatment. Especially in Kerala, the practice of giving Ayurvedic medicine on menarche itself is a custom. We are very happy to have Dr. Asmavi as today's faculty. She is having more than 10 years of experience in the field of Ayurvedic gynecology, and she is one of the best and renowned doctors in Kerala. A few years back, Ayurveda Medical Association of India organized a program called Vanida Clinic, Women Clinic, to promote Ayurveda treatment for all the gynecological diseases. AMA has given a training for thousands of lady doctors to start the Vanida Clinic. As a result, today, there is a chain of clinics in Kerala exclusively for the treatment of gynecological diseases. These trainings were led by Dr. Asmavi, our faculty. She has taken around more than 500 classes. She's instrumental in the success of Women's Clinic project. Dr. M.A. Asmavi is working as medical officer, Government of Kerala ISM department. She has completed his BMS and MD gynecology from Trivandrum Government Ayurveda College. She has treatment experience in the gynecological disorders, infertility management, PCOS, endometriosis, tubal factors and pelvic inflammatory diseases, and more. She has bagged the award Fishak Pratibha of AMAI. Thank you, Doctor, for accepting the invitation from Kerala Ayurveda Limited. Kerala Ayurveda Limited is a full spectrum and listed Ayurveda company in India with a rich heritage of over 70 years and well known of authentic Ayurvedic treatment and quality medicines. I welcome you, Dr. Asmabi, for the class. Shall we start, Doctor?
Yes. Yes, Doctor, we can start. Let me share the screen first.
Yes, sure.
Is it visible?
Yes,
Yeah,
yes,
it's okay.
yes, sir.
My voice is clear?
Yes, clear.
Yeah, okay, thank you. First of all, I would like to thank this opportunity to deliver a speech regarding a discussion regarding the menstrual disorders. Especially for these organizers, Sadat Doctor, Andrew Kumar sir, Dhanya Doctor, and all the organizers who behind this program. Here, the topic given is the menstrual irregularities. I think it's a vast topic, but even though for considering the clinical practice, I would like to share a nutshell of whatever the clinical conditions we are influencing in the day-to-day our clinical practice. So let me start my session. And also, I would like to know how much time I have to take for the presentation. And after that, I think there may be a good discussion also. So now 7:15. So how much time I have to take?
Yeah, it's around 50 minutes. Doctor.
50 minutes is enough. Okay. If there is needed to stop, you just intervene, Sadat Doctor. The time itself, I have to stop the presentation. Okay. Then today's our topic is the menstrual disorders. Actually, considering the women's health, especially there are so many conditions that have been described in our clinics and also like that. Here, especially the adolescent health and the preconception care, Garbhani Paricharya and postnatal care. Actually, these all things have to be very clinically, which were mentioned, but even though we are not practicing, very less practicing. So the importance of the Vanida clinic and whatever it may be, we are doing such activities to promoting these things, whatever mentioned by Acharyas. Also, we have to focus on the public and also towards the society. So coming to my topic, menstrual disorders. For that, we know what's the menstrual cycle is it, if it is normal. If you need the normalcy, then only we have to come across towards the abnormal presentations. We know from Rasa Dhatu, whatever we are taking, that will be changed into, or as per Dhatu Parinama, it may be coming to as a part of Saumya part of the Rasa Dhatu, which comes to us in the form of Stanya, and Agneya part of the Rasa Dhatu, which is changing as the Artava. And also for getting the proper menstruation and everything, the balance of tridosha is very important, like Kapha dosha on the just follicular development phase, and then Pitta dosha just after ovulatory phase, and then Vada during the menstrual phase. So that the cooperated or otherwise the coordinated actions of this dosha will also promote the normal menstruation. We know this Rajasrava and Rajapravrti, if it is Samyak, that will be Shuddha Artava. And if it is Asamyak, then that will be changed into Dushta Artava. So what is meant by the Dushta Artava or abnormal presentation? If we know that if there is anything interval, if there is any problem regarding the interval, if it is in heavy bleeding, that may be changed into polymenorrhagia or oligomenorrhea. If it is in less amount, that will be or amenorrhea. If it is duration is prolonged or otherwise if it is less, then that can consider as abnormal presentation. Color of the blood, we Shuddhartava Lakshana, like which is mentioned as the pure blood red color, and if deviation from any normal color, that also coming into Dushtartava Lakshanas. Then pain should not be severe in nature, and then clot should not be present in normal bloods. Askandi means without skanda or clots is the normal menstruation, and it should not be stain on the cloth. Now we are using suppose normal pads or otherwise menstrual cup, whatever it may be. In previous and old times, it was maybe used as the cloth itself. So it is to be mentioned as without any stain to the cloth. That is the Shuddhartha Lakshanas. So it is mentioned by our Acharyas. Then coming to the clinical presentation, what are the things we have to consider? One is the Krichrartava, then Amitartava, and Nashtartava. What is meant by Krichrartava? Krichrartava is the difficult or difficult menstruation or with painful menstruation. Amitartava means the abnormal uterine bleeding, or means artava which will be in a heavy amount. And then Nashtartava, that means the in term of amenorrhea or otherwise absence of menstruation. These are the most of the clinical conditions we can categorize into these three types of the in normal clinical presentation. So coming to Krichrartava, Vata Pradoshaja Yoni Vyapat are coming under this category, especially if it is considered Vatiki or Udavarta. If Udavarta, we have to know that Vego Udavartana Yoni Prapedayadi Maradaha Safenilam Rajaha Krichrad Udavartam Vimunjadi. If considering we can see the clinical features of the Krichrartava or otherwise the difficult menstruation or dysmenorrhea, we can see the features of this menstruation. Then coming to the premenstrual syndrome, we can't forget this part also, as in the physical or psychological conditions may be affected by the women, especially considering the women health or the psychological health of the women. PMS or premenstrual syndrome is a major problem. Physical changes like fatigue, backache, headache, and breast pain, breast tenderness, etc. may be happening to the lady. Psychological conditions like depression, irritability, anxious, mood swings, these are the things whatever happening to the female during or near to the menstruation. These also due to some hormonal changes or otherwise some psychological issues, etc. that may added factors during this time. So coming to dysmenorrhea, as per mentioned, as per Udavarta, this spasmodic dysmenorrhea or otherwise congestive dysmenorrhea. So what's the difference? What is the importance of differentiating these two type of dysmenorrhea? We know, coming to our clinics, so many patients are in adolescent age group or after the childbearing periods, everything, some lady patients may complaining about the type of dysmenorrhea. If it is differentiating, then it will be very easy to go for the treatment protocol, or otherwise we can consider the treatment pattern. If the spasmodic dysmenorrhea, it's mainly concentrated to Vatika type of dysmenorrhea. It's a Vatika predominance will be there. It's spasmodic in nature. It should be in lower abdomen, mostly in adolescent age group, and may be related to ovulatory changes. Psychosomatic factors may as an added factor. The important of the differentiating feature is the primary dysmenorrhea is that it will be start on onset of menstruation, and within few hours it will be reduced. Vego davartanad rajaha vimunjadi. If the bleeding will come, then the pain will be reduces. Then next, nausea, vomiting, fainting, fatigue, headache, calf muscle pain, like associated symptoms may be presented along with this type of primary or spasmodic dysmenorrhea. Then coming to the secondary dysmenorrhea or congestive dysmenorrhea. What's the difference here? If a patient is presenting as a dull and diffuse pain, it should be on the front of the lower abdomen and back, but it is not radiating. Then 3 to 5 days prior to the periods. In primary or spasmodic dysmenorrhea, it was noticed that it will be last on few hours. But here, you just notice that if a lady complaining, if any, not only lady, we most of the times we are assuming that the adolescent girls are presenting this spasmodic dysmenorrhea, but actually it's not the thing. In so many cases, these adolescent girls, they are presenting with some type of tumors, pelvic tumors, benign tumors, or whatever other conditions which may be related to this type of secondary dysmenorrhea, or then here it will be starting from 3 to 5 days or 1 week prior to the periods, and also which may extend to 1 or 2 days again. Here, whatever the age, it may be on adolescent or in Paris women, whatever the age group of the patient, we had to focus the presentation of the condition. And here, 99% of the cases, there will be any type of pelvic pathology. So surely we have to go for investigation. If it is ending for a few hours, then there is no need of much investigations. Here, Vatanalomana treatment is enough. Otherwise, we have to focus the pathology behind it. Then we have to think, what are the pathologies here? So the investigations here, the USG is the first, then second is the laparoscopy if needed, because some conditions like endometriosis or adenomyosis, etc., will be the golden standard is the laparoscopy, then hormonal assay or tumor markers. According to the conditions, we have to select whatever the investigations we needed. Then what may be the findings? We have to expect what are the findings here. So as per dosha predominance, if conditions like the pain, which will be normally this dysmenorrhea, it will be Vatika conditions like Udavarta, but here there may not be any type of pelvic pathology. But the conditions like endometriosis, we know that the progressively increasing congestive type of dysmenorrhea is the specific symptom of endometriosis. Here, like this Vatiki type of disorder is coming under secondary dysmenorrhea. Then conditions like Vata Kapaja, uterine fibroids and ovarian cyst, etc. here. Then Paitika conditions like Paitiki, Paripluda, Asrittara, and here the pelvic inflammatory disease. Here acute pelvic inflammation may be there, or otherwise chronic inflammation may be there, or abnormal uterine bleeding. These are coming under Paitika type of this presentation. Then Tridoshaja, again endometriosis is come not alone the Vatika predominance, but here the Tridosha involvement may be there. Endometriosis, adenomyosis, and some carcinomas may be related with this Tridosha type of presentations. So if there one patient is coming, if she is having 1 week or 3 or 4 days prior to the menstruation, she is having pain, then we have to evaluate, or otherwise to go for the proper investigations. Any of these, otherwise if it is not visible in the USG report, it may be PID, pelvic inflammatory disease. Then we have to evaluate by clinical examination, and also per PV examination is needed, and also we have to assess is there any dyspareunia may be there. So we have to put any leading questions to rule out or differentiate or otherwise diagnose this PID. Then some conditions which coming to the dysmenorrhea is the uterine fibroids. Uterine fibroids, mostly these are asymptomatic, but menorrhagia and congestive dysmenorrhea is the some factors. LBA, low back pain may be there. In some cases, infertility, because if the implantation process may be impaired by the presence of submucous fibroid or intramural fibroid, then there may be a chance to get infertility or otherwise pregnancy loss may be there. So we have to consider the site is not important than considering that site is more important than that of the site of this presentation. Here the large fibroid which is having the subserous fibroid which is not causing much problems, but here the small submucous inside the uterus or otherwise within the wall of the body intramural fibroid which causes much problem or otherwise pain, heavy bleeding to patient. So while assessing the features, we know most of the clinical features of the or otherwise the report of the uterine fibroids, which we can see the tracer large mass, because we know it's a connective tissue, fibrous and connective tissue. It's a solid mass. That's why the medicine response is actually very difficult. But even though then some presentations like Kabha Doshaja Vikaras, which may be most of the asymptomatic, in some cases like accidentally we discovered. Then Pitta Samsargaja Vikara, here the menorrhagia or metrorrhagia is the important one. Actually, this is the very problem to, or not a good prognosis considering this uterine fibroid. Then Vata Samsargaja, here dysmenorrhea or pressure symptoms may be the here the better conditions. Then some medicines also for Kevala Kabaja. Here we can consider Varanati Kashaya, Kanjanare Kukulu, etc. for this Tikshna drugs here. If it is Pitta Samsargaja, then we have to go for Kapha Pitta Shamana medicines like Dusparshakadi Kashaya, Praintyadi Kashaya, this type of medicines. And then if it is Vadanubandha, then we have to go for Chirivilwadi, Saptasara. Even these are having the Vata Kapha importance, but we have to consider some Tailas, like internally this Sahajaradi Taila, Kalyanakshara, and also Hindu Trigura Taila, etc. may be good here. Then coming to endometriosis, here also the dysmenorrhea, I mentioned the pattern, progressively increasing congestive type of dysmenorrhea. Dysuria may be there. Dyspareunia, coital tenderness is the important symptom here. Then pelvic pain and also low back pain. Then there may be pelvic adhesions also cause the deep type of dyspareunia. Then ovarian endometriosis is the most common site because if we are diagnosing from the USG, then we can see that the chocolate cysts are present on the ovaries. So here the chocolate cyst means that the presentations of the endometrium within the here the ovary, and also here this is the most common site for the endometrium, which is instead of the uterine cavity, which are coming to outside the other positions like here the ovaries and all. Then some effective medicines like Vatanulomana medicines, and also some combinations like Gulpanchavala Churna mixed with Rasasundura, or otherwise some procedures like Uttarabasti, including Narayana Taila mixed with Kalyanakshara. These are so many choices of medicines, but the treatment principles we have to follow, that is the Vatanulomana and also Snehana needed here. Then adenomyosis, instead of this, considering this endometriosis along with some Shobhara treatment, for example, this Punarnava, Punarnavadi Kashaya, etc., we have to add, but along with Vadanulomana, Shobhara medicines are also added to in the treatment pattern of adenomyosis. Then here, some treatment procedures, whatever considering these uterine fibroids, endometriosis, adenomyosis. Here, if the predominance of pain is there, then Snehana, Virechana. Virechana is also a very good treatment pattern here. Then Vasti. Vasti is considered, especially in case of Vasti is considered as the Ardha Chikitsa. But coming to the gynecological disorders, I found Vasti is the Purna Chikitsa in sometimes. Then Avakahasveda or sits bath within some medicines I will put here. And Yoni Piju, etc. is good. Snehana, there are so many choices like Sahajaradi Sevya, Danandara internally, Hingutrikuna Taila, Kugurutiktaka Grudha, Chirivilwadi Grudha, Mahanarayana Taila, Pipalyadi Taila, etc. Whatever the medicines we available, and according to the conditions, we can select the Snehana drugs. Then Virechana. Virechana is a good choice here because this Gandharva Taila or Anulomana is always needed here. Whatever the features which are presenting this dysmenorrhea. Vasti is very important, except some infectious conditions, we can select Vasti. Then choices of Vasti, here Kabaja, some Pipalyadi Anivasana Taila, Shadahwa Taila, Shara Taila is the choice. If Pitta predominance, then Mahanarayana Taila, Madhvishtyadi Taila. Then Vata predominant conditions, Sahajaradi, Danandara Taila is the choice for this Anivasana Vasti. And the Niruha Vasti in practical, we know the classical preparations of this Kashaya Vasti unlike that. If we are changing some pattern, if the Legana in uterine fibroids, endometriosis or PCOS, if we are doing, whatever changes we can do in the combinations of Dravadravya and also Kalka. Here, Sarshapa and Shatapushpa is adding as the Kalka. Dhanyamla along with Arandamula Kashaya, Dhanyamla or otherwise we can add some Saptasara Kashaya or Kulatta Kashaya towards as the Dravadravya. And then such combinations, the permutations and combinations we can use for the Vasti here. Then Vaidharana Vasti, that is also good for this if a patient is presenting most the LBA, usually Dhanyamla, Ambika, Jagri, etc. we are taking. Then Kshira Vasti, if the Pitta predominant patient and they want to do some Vasti procedures, then we can take Eshti Madhu, Kshira Paga, Guduji as Kalka. We can add some Pitta Shamana oils like Mahanarayana Taila or Tikta Gagrida. So such different permutations and combinations we can select this Vasti Dravya, Vasti Dravadravya, Kalka and all. Then coming to Yoni Piju. Yoni Piju, there are so many choices of medicines, but even though whatever the conditions, we can select some oils. If it is needed more Tikshna, then Kshara Taila, Pipalyadi Anivasana Taila, we can select. Shadahwadi Taila is a choice. Then if it is in a normal conditions, then Danandara Taila is enough. Then if Pitta predominant, then we can select the Mahanarayana Taila. Then if it is Vata predominant, like tubal factors or like that, the Sahasrara Taila is also a good choice. Then here, while doing the Yoni Piju, all the precautions we have to take if there is any infection or any, we have to rule out if there is no chance of PID or otherwise other infections. Then Avagaha Sweda or sitz bath. It's very effective in the management in the dysmenorrhea patients, especially the congestion, pelvic congestion syndrome. The Shimula Kashaya is a good choice. While we are doing this Avagaha Sweda, first of all, we are applying local abhyanga on the lower abdomen by using the any type of tailas we can select, which was previously mentioned. The Shimula Kashaya, Mirkundi Patra, Erenda Patra, etc. we can select for this Avagaha drugs. After boiling these drugs, we are sitting in for the half an hour or like that. Then generally we are giving during the periods, or if it is clotted bleeding, then Shadharna tablet will help for just to reduce that pain and clotted bleeding. Then Sudarshana tablet, Hingu, if there is any spasm or then acidity problems, like we can select Hingu Ajadi, Danandara Gulika. If it is on the lower abdomen and if she is having UTI or discharge problems, abnormal discharge, then we can select Chandraprabha tablet. And these are the medicines we can select during the periods. Then during the non-periods, means without during the periods, the Saptasara, Hindu Trikuna Taila, Danandara Taila, Mishraga Sneha, some Draksharishta or Abhayarishta, like anomalous drugs we can select without the non-period times. Then another condition is the benign cyst. Here I am explaining whatever the conditions are coming under the congestive dysmenorrhea. Here, which is the uterine fibroids and adenomyosis, endometriosis, like that. Benign cyst is also a reason for the congestive type of dysmenorrhea. Here on the right ovary is about 9 into 7.4 into 5.5 centimeter. We can see here, and also see we have to rule out if in such conditions like this endometrial hyperplasia or otherwise benign tumors, we have to check the any tumor marker. If it is elevated, in some conditions like endometriosis itself, it may be elevated, but otherwise, if it is in a higher value, we have to refer, or otherwise need for the to take a decision. Here it was very low amount, that is only 4. Then the after treatment, it was reduced that size to 3 into 1 centimeter, and her pain was to be reduced after the treatment. Here, dysmenorrhea, here also she is having 19 years, progressively increasing pain, congestive dysmenorrhea, hyperacidity and constipation was there. Her report which was shows that only 3.7 into 3.1 centimeter. We know that small cyst, if it is functional cyst, there is nothing to worry. It will be disappear within 2 or 3 months normally itself. But if it is increasing, if it is causing severe pain to the patient, then we have to treat that patient, and also that will respond accordingly. Here, the treatment pattern, Vatanulomana is the main treatment pattern we have to given. Here, the Saptasara Kashaya, Hingvajadi tablet, this Churna was given, and then Sugumare Eranda daily she has administered, and after the treatment, both ovaries are mildly enlarged, shows peripheral follicles and polycystic appearance, but that cyst was disappeared, and her pain also decreased after the treatment. Then some other conditions like PID I mentioned, pelvic inflammatory disease, and also some erosions. Here one picture which shows the erosions before treatment and after treatment, the Kshara Karma. Here also some conditions like associated with PID, pelvic inflammatory disease, or otherwise cervical erosion if it is increased, or increased cervicitis. That may also is one of the reasons for the dysmenorrhea patients. Then this is another case of the genital herpes. Here she is having severe pain, and also some pus type of discharge was there. But here also the Nalpamare Akashaya Avagaha along with Penvirs was also added to modern tablet one was added to that patient. But even though the Biogest tablet, which is I think from Kerala Ayurveda itself, the content is the Gugulu Panchabala Churna itself, and Tribala Gugulu Arakudadi Kashaya was given. Within 5 days itself, she recovered from that pain and severe pain and burning. So here such conditions but here also we can see the importance of this examination and differentiating whatever the conditions are coming to our clinical practice. So this is a case of 47 years lady. She is having LBA, IVGP, but here also we can see that is a large uterine wall prolapse is to be coming outside the uterus, and she unable to walk due to this problem itself. So that after this IVGP management, just some Dhanantara Thaila Piju was administered internally. But even though if it is on the 3rd degree or precedentia, it is not managed with our medicines. But even though she was contraindicated for surgical procedures, she's asthmatic and like that, so many other problems. That way she was contraindicated for the surgical procedures, and she came to OP. But even though some symptomatic management is only possible here. This is another case. She is having about 80 years of lady. The complete uterus is to be coming outside, and here we can see that the external os of the cervix here. The previous picture, which was the bladder, means the wall of the uterus is coming out, but here the complete uterus is to be coming out, and also here the cervical os is clearly visible. Here also only the symptomatic management is possible because these are all are surgical correction is needed here. But according to as per the age and other factors, these are contraindicated. That's why the problem. So here I would like to given a single message here. The diagnosis or treatment is incomplete without gynecological examination. If possible, we have to do for perspiculum examination, or otherwise, if it is not possible or not studied or not experienced with perspiculum, we have to go for vaginal examination, or at least we have to go for inspection. Because the previous cases like even Bartholin's abscess or Bartholin's cyst, uterine prolapse, even this genital herpes or other prolapse, whatever the type of prolapse, we can do, or we can diagnose from the inspection itself. So at least we have to go for inspection, and if possible per vaginal, and then for the other type of examinations. I'm not going this examination details here. Abdominal examination, pelvic examination, etc. are very important. Here from the scar endometriosis, some conditions like if the means endometrial tissue, if it is presenting on the LSCS, cesarean scar, then we can palpate from the lower abdomen of the patient itself. So the palpation is also very important. Then pelvic examinations like vaginal, rectal examination, and combined examination is needed to evaluate some cases or differentiate. So for that, prepare the patient. We have to explain what we are doing. Then and also to give a confidence, to attain a confidence with the patient, to keep a good relation, empathy, privacy is needed surely. The patient may be nervous in condition and fear about the pain. So we have to convince the patient whatever the procedures we are doing. So like for vaginal examinations like inspection, perspiculum and bimanual, etc. we can do. Whatever there should be a privacy, a proper light source is needed there, sterile examination instruments, and if there is needed like cotton, Dettol or 1% bleaching solutions, etc. is needed. So here also we have to keep all the aseptic precautions for the procedures and other things. So these are the headings mainly I described here for the dysmenorrhea or difficult menstruation. This is the one topic is over. Next is the amitarthava or abnormal uterine bleeding. Just I am giving only the nutshell now because due to the time limitation also. During the puberty menorrhagia, I mean, adolescent girls may be presented with different types of abnormal uterine bleeding. DUB is the 95% may be due to anovulation. Some endocrine factors may be the PCOS, hypo or hyperthyroid factors, ITP, von Willebrand disease, leukemia. We have to suspect different type of diseases. In case of this von Willebrand disease, the platelet count may be decreased and like that. Pelvic tumors, uterine fibroids, and even if the patient is in adolescent or we have to puberty age group, we have to think about if there is any chance for the pregnancy or abortion, because the time the patient should not reveal, but even though we have an insight, whatever may be the condition. The assessment of the bleeding, even not in the adolescent age group, but in the elderly people also, the long duration of flow, pallor, passing blood clots, increased number of sanitary pads, and presence of anemia. Then organic reasons like uterine fibroids, adenomyosis, we described earlier, if the submucous uterine fibroid, then there is chance for getting heavy bleeding. Adenomyosis, there may be get heavy bleeding and severe pain. Then IUCD, like copper T in utero, PID, then systemic diseases. We have to evaluate systemic diseases, if especially in perimenopausal women, if are coming, the liver dysfunction and also hypertension, we have to rule out the systemic illness. Here we can see that a patient is having presented with the abnormal uterine bleeding with intermittent menstrual pain and bleeding. On examination, it was found that a cervical polyp was there. Here, maybe due to this polyp, then maybe intermittent menstrual flow, which may be noticed here. And then some endocrine factors like hypothyroidism, hyperthyroidism, emotional upset, hormonal therapy, perimenopausal and postmenopausal conditions. Here, the von Willebrand disease, the most common hereditary coagulation abnormality. In all these conditions, heavy bleeding, bleeding time, investigations like clotting time, urine pregnancy test. We don't forget about the urine pregnancy test because there may be in the reproductive age group, there may be a chance to get the abnormal bleeding in ectopic pregnancy. So we have to rule out the UP. We have to check the UPT without any delay. Then platelet count, TFT. TFT we are doing very commonly. Then USG, and if needed, MRI is also the investigations here. So coming to our view, Ayurvedic view, Pradhara is considered as the, or Asriddhara is considered as the abnormal bleeding. Here the Ahara, Vihara, Nidana are considered as the factors for it. If it is Lavana, Rakta Pitta increasing, Amla, Lavana, Amla, Kadu, Guru, Vidahi, Snigdha, Viruddhashana, Adhyashana, and Ajirna. These are the factors which contribute for this heavy bleeding, and like that. Whatever the food items which increases this Rakta Pitta Kara, Amla Paga, and Ushnavirya, that may causes the increased bleeding. So during the bleeding time, we should advise the patient to reduce this type of food habits, and like that. Then treatment principle, mainly Anulomana, Garbhashaya Shodhana, Klayadahara, and Stambhana if needed. Because in Amavaste, Natu Stambhayed. If the patient is coming with 3 days of bleeding, she is having heavy clothes and also pain, she is having Agnimantya, Aruchi, and like such condition. If there is any Ama Anubhadha, we should not do the stop the bleeding as a sudden. But if it is in a free flow, if there is no clothes, she's having good appetite and everything, if there is no Amanubandha, then if it is in more days, we can go for the Klayadahara or otherwise Sankrahana medicines. Here, in conditions like this, Mahatiktaka Kashaya, Pittaka Kashaya is also very helpful in the to reduce the bleeding without causing acute stambhana. And then some Stambhana medicine is needed if it is prolonged bleeding, about 1 month of bleeding. Some patients are complaining about 1 month or 2 months, and like that. If it is not responded with progesterone tablet and then or otherwise Trapic MF, if it is not responding, then we can go for acute Stambhana like Pushyanuga Churna, Musaligadradi Kashaya, and Ashoka Churna, etc. will help. And then so many other preparations like Kushanuga, then Chandra Prabhavadi, Datri, Loha, Pratarata Rasa, etc. are there. Then some Krida preparation. If it is the bleeding is very less, but it is increased in long day, then Krida is a good choice to stop the bleeding. Like Tiktaga Krida, Phalasarpi, Shadavariyadi Krida are the very commonly practicing Kridas during the bleeding phase. Then, which was mentioned previously. Yes, then, but even though if the patient is coming with bleeding, especially on perimenopausal age group, we have to rule out the conditions like endometrial hyperplasia. If in case of this non-bleeding phase, we have to given some medicines to reduce the bleeding, like Kapha Pitta Hara medicines, and also Anulomana drugs like Trayantyadi Kashaya, Kanchanara Gugulu, Erenda Daila, mixed with Kalyana Kshara. Annabedi Sundura, because Rakta Prasadana is needed, not on the bleeding phase, but in the non-bleeding phase, the Rakta Prasadana we have to given to the patient. And on the bleeding phase, this type of Sangrahana or Stambhana medicines, according to the Amavastha, we can select Tiktaga, Kashaya, Pravala Basma, Pushyanuga Churna, Vasya Sarasa, etc. are the medicines we can select during the bleeding phase to stop the bleeding. And again, we have to continue the medicines to reduce this endometrial thickness and also other problems, whatever within the pathology. Here, this is a case report for the endometrial hyperplasia, which is having the before treatment and after treatment. Before treatment, the thickness was 16 mm on the perimenopausal bleeding, and after treatment, it was reduced to 9.7 mm. And after the treatment, her bleeding was reduced. And here also we have to rule out if there is any tumor markers, because if the endometrial thickness is high or increased, then the first test is the normally if we are doing, or we have to rule out the chance of adenocarcinoma, because if there is simple hyperplasia, even though if it is simple hyperplasia, not in the complex pattern, simple itself, there may be chance to, is 1 or 2% chance to adenocarcinoma, transforming it into adenocarcinoma. So that is CA124 or other tumor markers if needed, or in DMC or PIPLA test, as by using this endometrial tissues, we have to check for is there any carcinoma tissue is there. If it is not there, then we can treat with our medicines by using these means previously I prescribed the protocol. Here some cases I recorded here. On 16 mm, which was after treatment reduced to 4 mm. Her bleeding was 21 days before treatment, which was reduced to 9 days. HB was 7.9 and which was increased to 10.2. All these 5 patients are on perimenopausal bleeding, and on the first case she was turned into menopause itself. Then all other cases are not coming to menopause, but still continuing their normal bleeding. Here 16 mm, which is reduced to 9.7. Here 19 mm reduced to 10.1, 13 mm to 8.2, 17 mm to 10 mm. Here also the bleeding days, you just notice here 21 days bleeding, 28 days bleeding, 22 days bleeding, like that. Her prolonged bleeding was the important findings of the or important clinical presentation of the patient which is having the endometrial hyperplasia. Then some medicines I just noticed here, there's the Pravala Baspa, Rasaratna Samuchaya, Pitta Shamana is the and Shida Virya. I'm not going into details. I mentioned Triimtyadi Kashaya, Brahmi, Tribala, Nimba, etc. are the ingredients. And here also the properties like Kapha Pitta Shamana, etc. I'm not going in detail. Then Kalyanakshara is also from ingredients like Trikadu, Tripadu, Tribala, Dandi, Arishkara, etc. Here the dosage is 1 to 2 gram. We can mix it with Agrida, or otherwise Taila is the better Anubana. If it is not possible, then only we have to mix with Kashaya or Arishta. But I think it's the better Anubana, Grida or Taila. Then Kanchanara Gugulu, it's very familiar to all of us. Then coming to the third topic, that is the Nashtartava or the amenorrhea. Nashtartava, Grantyartava or Pushpagni are coming under this category. So we are consider all the menstrual disorders into Kritsartava, that's the difficult menstruation, then Amitartava, that is the heavy bleeding presentation, and third is the Nashtartava or the means delayed or amenorrhea type of presentations. Here coming to the PCOS or otherwise amenorrhea, considering this infertility also, anovulation is the important factors. Here the ovarian factors like ovarian reserve, luteinized unruptured follicle, luteal phase defect, etc. are the factors. But even though anovulation is important factor, we have to get in with good prognosis. Then as per Rotterdam criteria, oligoovulation, hyperandrogenism, on USG, there may be small follicles are the important criteria for the diagnosis. Then we know in PCOS, there is a necklace shaped, small follicles are surrounding on the to the ovary of the patient. The cortex will be thickness increased of the cortex. And here in the normal menstruation, we can see that here the follicles are developed here, the large Graafian follicle on the 14th or 16th day, and after during the ovulation, the ovum will come out. This is the normal picture of an ovary. Getting good follicle and also good ovulation. But here we can see that there is a necklace pattern of the follicles and there is no Graafian follicle is obtained, no dominant follicle is getting, and there is no ovulation. There may be the coordinated action of the hypothalamo-pituitary-ovarian axis is the important reason for this these problems. And here the coordinated action is needed to get the proper. Here the hormonal assay like prolactin, thyroid, FSH and LH, estrogens, progesterone, androgen, AMH, etc. we are doing for the examination. Here we see the normal values of this hormonal assay. Then coming to pathology, actually I'm not going into detail of this pathology. Here, what is happening in anovulation? If there is no LH surge, disharmony in the GnRH and LH and FSH, there is no ovulation, no corpus luteum formation, no menstruation, and also there may be metabolic risk, reproductive risk, and also PCOD changed into PCOS. There is syndrome of diseases. Then the Samprapti Gadaga, according to the presentation, it may vary, because if the patient is having PCOS but heavy bleeding, then the Pitta predominance may be there. But in most of the cases, there may be delayed cycle, obesity, and Avarana dosha. Then consider dosha as Kabhavata, dosha, Rasa, Rekta, Mamsa, and Mabus involved. Agni, not only the Jadaragni, but also this Dhatukni Madhya may be there. Then Vekta means only not in the Garbhashya, but the Sarva Sharira, like the acanthosis, then hirsutism. That is all the symptoms we are getting as the Vekta Lakshanas. Then Srodhoroda may be there. In the form of Sankha, Adipravarti, or Grandhi, maybe the presentations. Roga Marga is the Abhyandara. Then some clinical correlations like Jadaharinis, Pushpakni Jadaharini, we know Vrida Pushpam tu Yanari, Yata Kalam Prapashyadi, Stula Lamasha Gandava, Pushpakni Saturevadi here. Doshe Avrada Margatwa Dartavan Nashyadi Striya. What's happening here? Dosha Roda, Vada Kappa Roda, Sodo Roda, obstruction of Rodas is happening, and then some medicines, Vada Kappavrada Margatwa, Artavam, Nashyadi Striya. And then Tatra Samshodhananam, Agneyanam Chatravyanam Vidivat Upayogaha, Pittalai Rubajare. So, Artava Janaga drugs we have to use in such conditions. So, the treatment principles will be Vata Kapashamana, Kapameti Chedaga, Sroto Shodaga, Agni Deepaga, and Pittavardaka. Here, surely it will be Artava Janaka. There are so many choice of medicines may be there, like Kumarya Sava, Rajapravatri Vadi, Puli Lekhya, Kalyanakshara, Palashakshara. So many medicines are there, but we have to, according to the Yukti, we can select different type of medicines like Kanasha Dahwadi Gashaya, Chitraka Grandhigadi, Varanati, Kulattadi, Tilakwada, etc. Single drugs like Lashuna, Pippali, Shatapushpa. Shatapushpa is also very good, effective in PCOS management. Punarnava, Shundi, etc. Then coming to a general protocol of this amenorrhea, in some cases, if the patients are coming to our clinics, if we are prescribing some medicines or 1 week of medicines like Abhayarishta, or otherwise some Amrudotra Kashaya or Saptasara Kashaya, Shaddarana, even within few days, the patient will get periods. Okay, we happy and the patient will also happy. Actually, what's happening there? Here, the endometrial thickness of the patient may be more than 6.5 mm or 7 mm. Okay, then alone it will act as on a sudden within 1 week or within few days. But if you are giving to if you are continuing the same pattern of drugs for 1 month or 2 months, actually it will not be responding. So that at such conditions, we have to go for Agni Deepana medicines. Then after getting proper Agni Deepana, we have to implement some type of lipoproteins like our Grida, Taila, etc. Dadimadi Grida or Sukumara Grida, Kalyana Grida in very small quantity to ignite or to stimulate the hypothalamic pituitary axis and also to get some follicular development. So after getting the proper follicular development and also the endometrial thickness, then again we have to go for the Anulomana drugs like Abhyarishta, Saptasara, and Amrudotra, etc. So this is the line of management we have to adopt. In case of adolescent and multiparous, what we are doing on second day of periods or second or third day of period, the medicines like in very less quantities. After, if there is proper Agni Deepana, then Sukumara Grudha, Dadimadi Grudha, if it is stressed, then we can consider Kalyana Grudha or otherwise Tila Taila or Pipalyadi Anivasana Taila, etc. or Taila or Grudha, which should be considered a very less quantity in empty stomach. Along with some medicines like Kumarya Sava, Draksharishta, Bringaraja Sava, or this which increases the endometrial thickness of the patient and also which promotes the ovulation. Then after 2 weeks or 3 weeks, Then again, we have to give the Artavajana, stop these medicines and again go for the above set medicines to get the Artavajanaka or Anulamana. Then if we are treating infertility patients with PCOS, the first step is the same, because to get the proper ovulation and proper endometrium, these medicines we have to given on the first line. And after getting proper ovulation, we have to change the medicines to Garbhasthabana and also which promote the implantation, like Phalasarpis, Lakshmana Mula, Ksheerapaga, Pushanaka in less quantity, Ksheerabala, whatever the Pitta Shamana medicines we have to give after to get the proper implantation and after getting proper ovulation. Okay, this is the two line of management. If the patient is having proper endometrial thickness, and if she is not having the proper endometrial thickness, and then next is the if she is having in adolescent age group or in multiparous, they is having the same treatment to get the periods have to be regulate. If she is getting on the next cycle also, again we have to repeat the same procedure. Then if infertility, then consider for the implantation. So these are the common line of treatment we are doing. In lean PCOS, Shodhana Chikitsa is not mandatory. Medhya drugs and no role for the Medohara drugs. Here Kalyanaga Kashaya, Kalyanaga Gruda, Mantuga Barni, etc. are the Dadimadi. These are the some sort of Brahmana, and also for Agnidibana are the medicine of choice in cases of lean PCOS. Then some medicines we are very commonly practicing is the Saptasara Kashaya, Vata Kapashamana, Pitta Vardaka, Srodho Shodhaka, which is indicated in Prutsthartava, dysmenorrhea, and also pelvic adhesions. If we can, there are so many Anibana we can mix to here, like Hinguvajadi, Shadharana, Chandraprabha, or Tailas like Hingu Triguna Taila, and then Grudas, etc. We can, in combinations, we can select. Purely we can add Saindava, or as per the textual reference itself, there is some indications we have to add some Saindava, Hingu, fried Hingu, and powdered Saindava is also the some Anubana which are to be mentioned in classical reference. So Saptasara Kashaya, Chiribilwadi, Gandharvhastadi, etc. having the similar properties to get proper Agnidibana and Vatanala. Then next is the Kanasha Dahwadi. Here Kapavada Shamana, Pitta Vardaka, Srodho Shodhaka, and Artavajanaka. Especially if PCOS is associated with amenorrhea, if the patient is not having Pitta Prakriti, not having the Pitta predominance, then we can give, especially for the Srodho Shodhana. If there is Kapavada Avarana, then is a Kanasha Dahwadi is a very good choice. Here Kanasha Dahwa, Di Karanjadaru, Barni Kulate, Satile Vipakkum, Tada Resonene Siddhamampaha. Here we can note the ingredients of the means Kanasha Dahwadi. Here Rasona, Rasona is there, then Lashuna is there, and also Kulatta, Tila, everything is Kana, Shadahwa. These all ingredients are very Tikshna drugs. So it's having Kapavata Shamana, Pitta Kara, and is indicated in amenorrhea. So that such condition, if the patient, we know that in our clinics there are so many patients are coming with PCOS. Some patients having chronic amenorrhea and Kapavada predominance. Some patients having chronic amenorrhea but severe bleeding, withdrawal bleeding during the periods, and also with presentations of Pitta, means Pitta presentations. So that according to the Prakriti and also Dosha, we have to consider for prescribing any type of medicines. Then Tilakwada, which is having the same property, Tila, in Guda, Vyosha, and etc. Means Anubana for the Tilakwada. So also Pitta Vardaka, Nashta Pushpa, Nashta Artava, and Rekta Gulma are the indications for the Tilakwada, which promotes ovulation and also which produces some estrogenic effect. Here, I would like to mention this Kanasha Dahwadi Kashaya is the Kerala Ayurveda having some products like Ipa Kalpa. It's also main ingredient is the Kanasha Dahwadi Kashaya. Then next, some other yoga, Kriya Yogas I mentioned, Dadimadi Gruda, Sukumara Gruda, which are actually in textual reference. I'm not going in details. Some conditions like this amenorrhea, PCOS, low AMH value, infertility, and also it helps to improve the endometrial thickness, and also some having estrogenic effect. Here a case of primary amenorrhea. She's having 19 years, lean patient. Here the importance, first of all, the Agni Dibana medicines like Saptasara Kashaya, Ashtachurna was given. Then after that, because actually I tried her LMP was 1 year back. When she came to OP, she's having 19 years and her previous menstruation was on 18 years. So that's why I tried some internal medicines as considering the endometrial thickness and all, but it doesn't work. After that, I selected for done her Snehapana treatment by Acha Snehapana itself, and Swedana Utpreshna was done. After that, Vamana is also carried out. Actually, on second day of Samsarjana, or after Vamana, the menstruation is attained. Here also the importance of Shodhana Karma, especially if the patient is having chronic amenorrhea, it will help to, in fertility cases also, it will helpful. So here, so many cases which are having, here the age of the patient 21, LFP 4 months back, PMP 3 months back. Here also on bleeding, to induce the bleeding, Kanashada Hodikashaya, Hingujadi, Abayarishta and Rajapur remedy was given. After getting her next periods, Sugumara Grada in small quantity, Kumari and Draksha, this to improve the endometrial thickness. Shatapushpa Churna mixed with Jaggery and the Tilataila was given. So actually after this pattern was changed here on the 3 weeks, it's continued, and after 3 weeks again this Kanasha Dahwadi and Hingvajadi etc. are continued. Like that 3 months are repeat. 3 months repeated the same procedure, and now she is getting her periods within 40 days. Previously it was 3 months, then again it coming within 2 months, and now she is getting within 40 days, 7 days of bleeding. So that is the average treatment protocol we have to follow. Then this is a case of POF, premature ovarian failure. Just we have to differentiate what is the PCOS and POF. Here the age of the patient is only 24. You have just noticed here the menarche of the patient was 14. All the secondary sexual characters was present. On 2021 January, up to January, she has regular cycles, and March there is no cycle. She induced with progesterone tablet. On May month she induced. Then after that she came to OP. Then after giving this Sukumara Grada and also Dadimati Grada, Tilakashaya, mixed with the Naga Pushpa and also Vyosha. After that, she get her periods regularly now. After this after May, I think she reached the OP, and now all the months she get normal periods. Here, the diagnosis of actually the POF is a bad prognosis, because we know premature ovarian failure. Here, it is a bad prognosis. We know if the FSH value is increased, like that of a menopausal value, and the volume of the uterus and volume of the ovary mainly, which will be decreased. Here the both ovaries shows the reduced size. Right ovary is only 1.3 into 1 centimeter, left ovary 1.5 into 1.1 centimeter, because the normal volume of ovary we know about 3 into 2 into 1, that's length, breadth and thickness, which was reduced to 1.2 centimeter. Here we can see the AMH value only 0.23 and the FSH value was increased to 18.48. This FSH value was increased here and AMH value was very, very decreased. But the proper intervention within the proper time is very predominant here. That's why maybe the reason to get normal periods after that. Then some congenital malformations, like here on the speculum examinations, we can see that there is a double uterus and also there is double cervix. Here some abnormalities like here the bicornate uterus and bicornate cervix may be there, but here also some type of congenital anomalies we have to rule out. Then hypoplasia of uterus, if the patient is having amenorrhea, if there is an induced cycle, there will not be any periods. On USG we can size that the size of uterus is very small, that is only 2 centimeter into 4.2 centimeter. Here on the reports it is that small sized uterus and ovaries. Here after checking her AMH value, it was less than 0.01, and here the FSH value is 61.8, that is on the menopausal. But here this patient get after a long time of amenorrhea. We have worked a lot here but didn't respond. So we can see that if the patient is getting very just after the missing of the periods, we can manage with our Ayurvedic medicines, but otherwise if it's a prolonged period or chronicity, it will not respond. Just I will conclude within some minutes. Here the last case of the say primary infertility with 11 years. Here she is having weight 95 kg, married since 11 years. AMH value is increased in this type of amenorrhea. Here the PCOS, LMP was 4 months, induced cycles for 6 years. For the past 6 years, she was only induced bleeding by using the progesterone pills. And the internal medicines given us the Chirivilluadi Kashaya and Vaishwandara Churna to get the proper Agni Deepti, which was given on the morning. And on examination, it was found that there is some white discharge and like that. So Nirgundyadi Kashaya mixed with the Tribala Gugulu was given evening, and Annabeti Sandura was given to that patient. So after getting the internal medicines for 2 or 3 weeks after getting proper Agni Deepana, then procedures like Panchakarma procedures was done, Uddurtana for 9 days. Then during that period itself, the Rukshana like Kakrapana, then Snehapana start with Sarshaba Taila. Sarshaba Taila is a good choice in acanthosis nigricans, obesity, insulin resistance. Then Sarshaba Taila is a good choice. After Snehapana, Vamana was carried out. Then after she attained her menstruation, some internal medicines like Saptasara Kashaya, Shatapushpa Churna was given. Legana Basti was done internally. Uttravasti was done by using Mahanarayana Taila and Kalyanakshara. On the second cycle, Leganavasti and Uttravasti was done without Shara. After 3 months, she reduced her weight to 10 kg. From 95 kg, it was reduced to 77 kg or 75 kg within some months of treatment. And her periods was coming to almost normal cycles. And before treatment, her mild hepatomegaly and the both ovaries shows the PCOS pattern. And after treatment, she got a dominant follicle on the right ovary, which is having 6 point, I think the dominant follicle on the right ovary, 18 into 16 mm, and her endometrial thickness was 11.7 mm. It was trilaminar. And on that cycle, on the dominant follicle, that lady got conceived with that LMP 22/6/2019. After the conception also, she's having severe pain, low back pain, vomiting, and etc. Here the Nayopaya Kshiropaga was managed. This Bala, Jiraga, and Nagara should be prepared from the home itself, and Mahadanandara tablet was added. Here, without much problems, she continued her pregnancy along with conventional management, not along the Ayurvedic medicines, but the conventional management, modern management was also given to as a parallel. That was the after on 8/3/2020, she delivered a healthy baby with 3.26 kilogram. And this is the paper which was published regarding that. That same case, this Ayurvedic management of infertility associated with polycystic ovarian syndrome, a case report. So here that let me conclude the session. To keep the menstrual cycle healthy, we know the menstrual irregularities like Krishnartava and also Amritartava and Nashtartava explained. Some conditions are to be explained here, just only a nutshell only. Then to keep the menstrual cycle, the proper dinacharya is very important. Rutucharya and also Rudumati Charya. Some points are to be explained in the Rudumati Charya is also like to take the light food during the or near to the menstruation, and we should keep some hygienic, and everything should be explained in detail. So that we, to get the proper cycle to be keep, a biological clock is needed to such. We can say that so many patients having, if they are working in IT professionals or other night shift like nurses or other, there are so many professionals which having the night shift, and there is not proper the sleep pattern, that also may affect the menstrual cycle. Because if the exercise is also good, exercise is needed, Vyayama is surely needed, but the over exercise also, some like athletes, some of the athletes are also presenting their menstrual problem to the menstrual cycle. So that we can consider not alone the exercise is now means considering the these factors, whatever needed, dinacharya, rutucharya, or the proper exercise, but the excessive type of exercise is also cause the irregular problems here. More than that, without any stress, stress is an important factor. Whatever considering during the lockdown time, the students, college students, school students are coming. So many type of issues. Their sedentary lifestyle and their pattern in the biological clock and their changes in the food pattern, and also the stress and the sleepless nights sometimes. So we have to move meaningfully and also take the proper calm stress, and we have to advise that this type of patient for that, and to take a food which is having healthy plate. Healthy plate is important according to the seasonal foods, including whatever the cereals or whatever the fruits or vegetables which is available. We have to consider the food for as the healthy plate is needed for that. So let me conclude the session for again and again. I putting to the message for to taking this menstrual health and like that. Thank you for all the participants who are listening here and the coordinators, all the coordinators for this opportunity. And more than that, all the patients, my patients who are for this clinical practice, there are so many patients that very patiently they are considering for their treatment and their outputs like that. And my gurus and all the teachers who are giving such type of knowledge and like that. And thank you once again. Thank you all.
Thank you so much, Doctor. It was a wonderful class.
Is the time limit is over now?
Yeah, it's normal. It's a very interesting class. So that's time is not a limit actually. So that the class was very informative, and I think it has covered all the aspects of menstrual disorders. Definitely. So there are some questions in the chat box. So many questions are there. I think I just ask a few questions, very important questions. Can you answer it? That can we start?
Yes, Dr. Sure.
The chronic leukorrhea, many Ayurvedic, sometimes the chronic leukorrhea conditions, many medicines are tried in Ayurveda, but not yet cured. But how can we do that? I think the doctor already mentioned some inflammatory conditions. So can you explain that is better?
Surely. Chronic leukorrhea, we have to rule out first their health status of the body. If there is the general health is very weak and such conditions, we can some Brahmana drugs or some nourishing medicines, like we are commonly practicing Shadavari Gula, Masali Gadradi Kashaya, and also Shankabhasma mix. Some type of medicines we can give. These are our normal practice. But actually, if a patient is presenting with leukorrhea, we have to examine that patient. And also, or if it is not possible to examine, we have to consider some points. If it is Kapha dosha predominant or Pitta dosha predominant, and like that. If it is Kapha dosha predominant, there may be itching, vaginal itching, and also some Shaitya bhava or whitish color of discharge, etc. will come. Conditions like Trichomonas vaginalis, candidiasis, these are the common bacteria or other infections may happening there. In such conditions, we have to go internal medicines like Kapha Pitta predominance medicines such as then Aragodadi Kashaya, Nirkundyadi Kashaya. If it is needed, if there is any itching, deworming is very important. If any type of vaginal discharge, first step is the deworming. If needed analomana, then Virajana is a good choice. Then internal medicines like Aragodadi Kashaya, Aragodharishta, if needed, then Nirkundyadi Kashaya. If there is any inflammatory conditions and also cervicitis, then we can go for the Tribala Gugulu and Rasagandhi milk, etc. Hello?
Oh, yeah.
Yeah.
Yeah, it's okay. Another question is amenorrhea without or without hypothyroidism. How can we manage?
Amenorrhea?
With and without hypothyroidism.
Okay.
What is the difference, and how can we both the conditions? How can we manage it?
Yes, okay. Amenorrhea with hypothyroidism and without hypothyroidism. Here in without hypothyroidism, we can consider the pattern same as explained here, considering this endometrial thickness. If it is proper, then go for the Anulomana and Arthavajanaga drugs. And if there is hypothyroidism, then we can focus the hypothalamo-pituitary axis. And also it's better to do for the Shodhana treatment, including Takradhara, Snehapana, etc. is also good choices. Then internal medicines like Praindyadi or Varanadi, Kansanara Gugulu, and also some Gridas like Gugulu Tiktaka Grida, or according to the presentations, we can select such type of drugs also, Varanadi Grida if needed like that. Then one point I missed on the previous question, this if the leukorrhea, if it is Kapha predominant, I explained, and if it is Pitta predominant, if there is cervicitis, then also some Avagaha Sweda or Kshalana by using Nalpamara Kashaya. In other condition, if it is itching, then we can go for the Araghata Kashaya or Prabala Kashaya mixed with Akkana. There are so many practices are there, even Kshalana, Kalkadarana. These are the to management of the chronic leukorrhea. If it is chronic cervicitis, then Madhusnuhi Rasayana, Guglutikta Grada type such Guglutikta. These are the different type of management. So according to that, we have to examine, if possible, examine the patient, or otherwise, as per dosha predominance, we can give the medicines internally and also for the Kshalana and Avagaha, etc. Okay.
Okay, thank you, doctor. One another question is that one case history like that. One 40 years of lady, they have around 15 mm endothelial thickening, and also every time they have given the Rajapravartana body to get the cycle. Otherwise, the period won't come. But the endometrial thickening will still remain like 15 mm. How can we manage? Like?
Yeah, okay. Here also, I think I explained very details in like endometrial hyperplasia. Here, the thickness of the endometrium is more than the normal thickness is about 15 mm. Actually, if here the non-bleeding phase, we have to go for Tikshna medicines or Lekhana medicines like Varanadi Kashaya if the bleeding is not heavy, then Praindyadi Kashaya, Kansanara Gugulu, Anulomana drugs like Gandharva Erenda mixed with Kalyanakshara. So whatever the Lekhana, Anulomana medicines given on the non-bleeding phase, and during the bleeding phase, if the heavy bleeding, then we can go for after 2 or 3 days. We have to allow the patient to bleed. If the patient is not so tired, there is not much problem to the patient, then we can allow the patient for 2 or 3 days for bleeding. Then after that, we can give the Tiktaga Kashaya or Mahatiktaga, then Pravala Basma for Stampana medicine. Again, the same procedure we have to repeat. After stoppage of the bleeding, then again we have to give this type of Legana medicines. So that after, I think within 2 or 3 or 4 months itself, the thickness is normally will reduces. Or any other, if it is not getting good response, then you have to check about is there any endometrial adenocarcinoma or needed to take any pipillate test, not needed to DNC and biopsy. We can from the pipillate test itself through the endometrial tissues can be through this from the cervix itself. We can collect the endometrial tissue and the examination or investigation for that endometrial tissue. We can rule out any chance of adenocarcinoma or cancerous tissue is there. After that, we can manage. If it is not such conditions, we can manage.
Yeah, thank you, doctor. The one another question is that the one interesting one. Even though the menses are regular, all the tests for male and female is normal, and some women fail to conceive. So how can we diagnose this and what's the reason or anything you can advise?
Actually, this can be considered under as the unexplained infertility. So in such cases, we have to evaluate both the couple, male and female, whatever any, while taking the proper history and also proper their history taking, we will get some points. It may be related to some dosha predominance, or in some patients, they will say that she's having some increased body heat or like some pitta predominance. In their coital history, there may be some problems in the lubrication and like that. Ladies having some lubrications or their sexual history. We have to evaluate the complete picture, and we will get any of the points, especially assessing the dosha predominance also. So if there is any means doshic involvement, we have to prepare or we have to plan for a pre-conceptual preparation for starting from the Rukshana. And if it is internal itself enough, if it is IP procedure, if possible, then we can go for like that. Or otherwise from the as a calendar or as a schedule, we can given to that patient starting from Agni Dibana, and then after Snehavana is in the form of Acha Snehavana, or otherwise in the Vijarana Sneha, according to the condition and other factors of the patient, both the patients, male and female, we have to go for this type of preparations. According to different factors, we can select the Grudha or otherwise Thaila. I explained in some conditions here. If it is any obesity or like that, then we can select this Sarshapa Taila. If she is having Vata Pitta predominance, then Shatavariyadi Kruta or Mahanarayana Taila. If there is Analomana is less, then we can select Sukumara Kruta. Such that there are so many medicines are available. So out of that, from the history taking, we have to plan whatever the medicines, whatever the internal medicines or Sneha, we have to give that patient. So first Tukshana, then Snehana. After that, proper Virejana. If possible, if needed, Vamana we can go for. Otherwise, Virejana. And then to monitor in case of male, all the motility, morphology, and everything should be properly monitored. And in female case, the proper ovulation, if there is proper endometrium, and whatever the factors there, the intercourse means coital history is also correctly we have to asking about is there any tubal factors, and everything should be evaluated, and we can give a good type of counseling and pre-conception preparation. Then I think in most of the cases of unexplained infertility case may respond.
Yes, Doctor, very, very clearly explained exactly. And one question is the Lakshmana Moola Kshirabha. Doctor already mentioned about the medicine and what is the dose and how many times we have to give.
Yeah, normally it is better to give after ovulation because it's as the Pumsavana, it's mentioned in the Pumsavana treatment, this Lakshmana Kshirabhaga or in nasal drops, etc. But in practice, we are giving it for the Garbhasthabana. So it's better to give after getting proper ovulation, and we advise the patient to do the proper coitus, and if it is everything okay, then we can give this Lakshmana Kshirabhaga as the same procedure. Whatever we are preparing, this Kshirabhaga is enough here also.
Okay, one another question: what could be done for reduce ovarian reserve, which is causing infertility?
Yeah, ovarian reserve, if it is in decreased ovarian reserve conditions.
Yeah, I think the question they have mentioned the opposite answer, and what can be given for the increase the ovarian reserve actually. Yeah.
Yes, okay, doctor. The condition is actually the increased ovarian AMH or
AMH too.
Yeah, AMH.
AMH, exactly.
Anti-mullerian hormone value, if it is increased, then also that it will causes it affect the quality of the ovum. If it is decreased, then it will be very difficult to in some conditions. Here in PCOS and other associated problems, the AMH value is increased more than 6 and 6.5 like that. But in low fertility rate, which we can see that the AMH value is very reduced, normally less than 1 or less than 1.5. I think 2 up to 2 we can consider as normal AMH value and normal ovarian reserve. Here our Ayurvedic approach is that to get, if the ovulation is in most of the cases, if the except in conditions like premature ovarian failure and also unexplained this type of pathology or hyperplastic uterus, then these conditions like ovarian reserve will be very, very less. Actually, it is having very bad prognosis. Except these conditions, we can improve the AMH value by giving some medicines to improve the quality of the ovum, like that Shatapushpa Churna, Sukumara Kruta. Then in some condition, if there is having Agnimadhyan like that, Chirivilluadi Kashaya mixed with the Tippali Churna. Some patients which is having AMH value reduced and she's having Pitta predominant conditions, then Drakshadi Kashaya and Datriyadi Kruta. So according to the presentation of the patients, we have to improve the quality of the ovum is the treatment line of approach in reduced AMH. Whatever the value, but if the ovulation is correct, the periods is regular, some sonologists are opined that while getting this AMH value ovarian value reserve cases, the ovum is not as such healthy in some other conditions like that of other patients, and here some blighted ovum or there is only sac is there, not a good and healthy ovum as there. But our role to improve the quality of ovum in such cases.
I think the time is over. Anyway, one or two questions also we can ask actually. The significance of testing of CA125. Normally we are doing the test, and the uterine test. Any other significance? What is the significance of
Actually, CA125 we are doing routinely in case of benign tumors and then means endometrial hyperplasia, endometriosis. In all these conditions, actually, it is a raised value we can see. But it's normal value about 35 and within a limit of 35. But actually, if there is any endometriotic problem, that value may be raised. But all if it is increased to 50 or 60 like that, we don't think about it is actually it is not cancer. But even though some tumor markers is elevated and some action is or some changes are happening in that tumor or otherwise in the endometriotic tissues. I found in some cases like 300 or value above 200 and 300 this year 125. If it is an increased value, then we have to refer to get biopsy or like that. It is also the significance is coming during the prognosis also. Some cases with endometriosis or benign cysts, we can see that with our management, if our line of management is proper, if it is getting good upashaya, then the CA125 is also will decreases. In one case, I found that 48 or 50 was there. Then after 1 month of treatment, the size of the cyst was reduced and the CA120 was changed or reduced into 14. So that we can, the significance is coming here is that whether we have to refer a patient or whether we have to continue the treatment. Is it our proper, this trial and error method, is it going in proper way? So that's why we have to evaluate by using these techniques. Not only every time it may not be sometimes significant, but even though during these conditions, we can consider this value, tumor markers.
So a lot of other questions are there, but most of the questions and answers already you have already explained. And one important question is that what is the difference in the treatment of obese PCOS and lean PCOS?
Actually,
that's
it is
clinically very relevant. That's why you please explain. That's the last question we can explain.
Yeah, very relevant. In obese PCOS, mostly we can see that our typical features of the Pushpakni Jadaharini, like hirsutism, and then most of this obesity and acanthosis, all the symptoms was present here. And mostly here, the Kabhavada Avarana may be the important reason for the this amenorrhea. And if the patient is obese, then we can consider to improve the, even though if it is obese, there may not be the proper acne maybe there to correct the Jadaracne mandya and also the Attakne mandya. It's better to do the Shodhana treatment if possible, starting from Udvartana, Rukshana, complete Rukshana is needed at first level, then go for some sort of the Snehana, mild Snehana is needed, and then Vamana is a better choice of treatment. Like that we can go. The correct follow for the food like the Apishandi Ahara, we have to advise the patient to reduce the or avoid this type of Apishandi Ahara and also sweet items, carbohydrates less item, and this type of food habits and exercise we have to given that patient. The medicines like Artava Janaga, even Kalashadahwadi, then Hingu Triguna, Pipalya Dyanavasana Taila, Sarshapa Taila, etc. are the choices. Maranadikashaya, like Artava Janaga medicines, here are the choices. But in case of lean PCOS, there is such type of Uddartana and other Lankana procedure is not needed here. Sometimes it is considered that more stressed and also they having the hypothalamo, the other category were coming under the Sukumara type of or sedentary lifestyle. But here, these are more associated with stressed pattern is most commonly. So that we can give some, after getting proper Agni Dibana, here we can give some Kalyana Gruda, Kalyana Kashaya, some Medhya Rasayanas, also to get proper development of the ovulation, proper development of the follicles, and also to get the menstruation regularly. To get the counseling, stress relieving factors, Agni Dibana, and also like some other our medicines.
Yeah, one question is about the Ivakalpa. I think I can explain that. What is indications of Ivakalpa, Kerala Ayurveda medicines? I think the secondary amenorrhea, dysmenorrhea, PCOS, and oligomenorrhea, like the delayed menstruation. All these conditions, the Ivakalpa is very effective. That's clinical trial answers again. I just explained it. I think that we can, a lot of other questions. So the last question I just asked, and then we can conclude. That is better. In menorrhagia, what will be the medication to stop bleeding and with less period of time?
Less period, I explained properly. I think
exactly. One second, because Again and again the questions are there.
Sure. If there is amanubandha, then we have to give some sort of amavaste na to stambhayed. So if she is having clotted bleeding, then Agnimantia, Angamarta, Aruji, then we just go for, if possible, we needed to consider some Shantarana tablet also. Otherwise, Tiktaga group of drugs, Tiktaga Kashaya, Mahatiktaga, etc. on the first step. Then after getting 1 or 2 days, we have to wait for that. If there is no Agnimandia, there is no Ama, then directly we can give some sort of this Pravala Basma. Commonly I am practicing this Pushyaniga Churna, Pravala Basma, and also Tiktakam Kashaya. Here, there are so many choices. Here, the Musaligadradi Kashaya, then some patent drugs are also sometimes available. Then Vasha Sarasa is also good choice, mixed with honey. These are the drugs we can select for the to stop the bleeding.
Any particular Anubana is says for the Pushyaniga Churna or something?
Yes, surely. Pushyaniga Churna is the means rice water, rice washed water is the better Anubana for the I think.
Exactly. That's.
Okay.
Thank you, doctor. Thank you, and you have cleared all the questions from the participants, and now the time is for the wind up. Once again, I thank you, Dr. Asmabi, and all the participants. Now, I request Dr. Anil Kumar sir to conclude the program and deliver the vote of thanks. Please, sir.
Yes, thank you, Dr. Sadat. Thank you very much, Dr. Asmabi, for that excellent presentation. You have given good insight to the vast subject within a short period, and it has been very meaningful and informative. I think a lot of young doctors coming up will definitely choose gynecology for the specialization, especially for the patients who is suffering from various diseases on the dysmenorrhea and amenorrhea. And so that was a very good presentation, and you have covered all aspects as mentioned by Dr. Sadat. And thank you for accepting our invitation and presenting this subject. Thank you, Dr. Asmabi. And thank you, Dr. Sadat, for moderating the session. Thank you very much. And thank you all the participants, the doctors, for this participation, taking their time to participate in the late evening after having a good practice. So I appreciate that, and we have good people attended this webinar. Thank you all the doctors, and we look forward for more participation. We'll be coming out with more subjects in this webinar. So coming month also we'll continue this webinar for a long period, because we believe that sharing information and educating or educating the younger doctors will be a more requirement for the relevant period. So we will be continuing this webinar. I would like to thank and appreciate the KL team for conducting this webinar in a very good manner, especially Dr. Danya for hosting and leading this webinar. We have with us also Mr. Manigandan, Senthil, Sumesh, and Shiva Prasad, who has taken care of all the IT part, and also Samir and team, who has the sales team, who has given a good support for the participants to appear to be present in this webinar. So thank you everyone for this wonderful participation. We look forward for more participation from all the doctors, and we will be coming with good subjects for you. Thank you very much. Good night. Have a nice night, and also be careful on this COVID. Take care and be safe. Thank you. Thank you all. Thank you very much. So with this, we conclude. Good night.